Biomedical engineering is an interdisciplinary field that applies principles from science, technology, engineering, and mathematics to create solutions to healthcare problems. The mission of the Institute of Biomedical Engineering is to expand the field of biomedical engineering in South Africa through research and development. At the Institute, we have our director, Martin Nieuwoud, who specializes in molecular diagnostics and machine learning, Davie van der Heever, who does research in neural engineering, Cornel de Jong, an expert in injury biomechanics, and Johan van der Merwe, who focuses on developing orthopedic engineering solutions. What follows is a brief introduction by each of our staff members of their respective focus areas.
Good day. My name is Professor Martin Nieuwoud. I am the director for the Institute for Biomedical Engineering. In terms of research interests, I am particularly interested in machine learning and the Internet of Things for medical applications, tissue engineering, including additive manufacturing for biomedical applications. I am also interested in causal statistical modeling for disease prognosis and treatment outcomes. I do actively collaborate with industry, molecular scientists, and machine learning engineers, and some of the projects there is likely to be funding available. Thank you.
The brain is the most complex and awesome organ in the whole of the universe. It's responsible for our every thought and action and memory, feeling, subjective experience, all of it. However, the brain is still clouded in mystery, and it's our job and aim to demystify the brain. And we do this with our specific focus areas and interests. So first, we try to decode mechanisms in the brain using clever experiments and machine learning techniques, and with the EEG headsets. A fun one is we look into free will and decision making. And spoiler here, free will is not what you think it is. We investigate the effects of meditation, what the effects of meditation has on the brain, and then in your resulting behavior, and there's evidence for big effects in concentration and memory and just well-being overall. Together with a team at UCT, we are looking at machine consciousness. So we want to see if it's possible to instantiate consciousness in robots. So that's also fun. And then most recently, we've been looking at using virtual reality to also understand the brain. And you can make cool new environments to help understand mechanisms of the brain, like moral dilemmas in a virtual environment. And then for a bit more real-world application, we use virtual reality as exposure therapy. So you can expose people with arachnophobia to spiders and see how they react in this virtual environment. So this is all great fun, and I hope some of you wouldn't mind working with me and trying to demystify the brain.
So injury biomechanics is the science relating to the deformation of human tissue past its mechanical failure limit, which will then result in clinical injury. And we relate this to a mechanical causation using mechanistic classifications, which are closely related to the engineering mechanics we know as mechanical or mechatronic engineers. So these mechanistic classifications have been determined and tabulated over years of research and cadaveric studies, in other words, using cadavers. And if we know these mechanistic causations, it allows us as engineers to quantify injuries, either through experimental or numerical analysis, such as simulations, on the anatomical region of interest. And we can do this by measuring the forces or bending moments and other biomechanical parameters that occur in these regions in response to a specific applied load, which is an external load such as a crash or a fall or other impacts. And we often use crash test dummies or ATDs, anthropomorphic test devices, as our vehicle, if I can call it that, to measure forces at specific joints or on the head, in the head, or on the neck. So this is basically our instrument that we use to quantify response parameters. So after having quantified the required parameters that we need, we can then determine the likelihood or risk of a specific injury from occurring. And that can be determined by relating the measured force parameters that we've just determined by dropping our dummy on its head, for example, by relating these parameters to established injury criteria or injury assessment reference values, IARVs as they are called. And this then allows us to determine the clinical risk of specific injuries. And we can then furthermore use established risk curves related to the risk of specific injury levels, such as the abbreviated injury score values or injury severity score values, to determine the overall risk of injury from a clinical perspective. So this is where that breach between engineers and doctors or the medical fraternity occurs, and where we can communicate to doctors what the risk of injuries are related to a specific impact or related to using some other intervention device such as a helmet or a neck brace or a knee brace. And how does that then reduce the risk of clinical injury? And how does an airbag, for example, reduce the risk of clinical injury? So this is what injury biomechanics is about in a broad sense. Another component of injury biomechanics then also involves determining injury thresholds and IARVs through experimental testing. And in this way, it also contributes to the available literature and improved product development. So the literature that we as test engineers use to quantify the risk of injury can also be developed as another field of injury biomechanics. And that involves cadaver research, cadaver impact testing, etc. And also a lot of working together with doctors and surgeons and so on. So that is in short what injury biomechanics is about, and you're welcome to contact me for any further information regarding that.
Hello, I am Johan, and I focus on creating methods, techniques, and tools to automate and integrate the development of patient-specific orthopedic solutions. So in South Africa, patients often present for medical care with very severe musculoskeletal trauma and diseases due to the high prevalence of personal violence, road traffic accidents, and insufficient access to early treatment. In such cases, conventional orthopedic treatment options may not be viable, and instead we need to use customized implants, instruments, surgical guides, navigation, or preoperative planning tools to treat those patients. However, developing patient-specific solutions is a multidisciplinary and iterative process that requires extensive and time-consuming effort on the part of various stakeholders. So this leads to increased expense and delays in treatment within a healthcare system that is already constrained in terms of resources. Therefore, our aim is to reduce the associated effort and cost by incorporating unique patient data into population-based models, and from there to generate or adapt pre-programmed customized solutions to treat patients. So in addition, we also pay special attention to the role and interaction of the various human stakeholders in this process, as truly robust and practical solutions must incorporate input and feedback from human specialists within the design loop. Thank you very much for your interest in our institute. If you would like to know more about biomedical engineering or about the work that we do, please do not hesitate to contact any of us. Our contact details are available on screen now.